Hi, everyone. My name is Heidi Chen. I'm a PGY5 Interventional Spine and Musculoskeletal Medicine Fellow at OSS Health in York, Pennsylvania. I am the past president of the Physiatrist and Training Board, also known as the FIT Board. And so welcome to our second Q&A with Dr. Stephen Flanagan, president of AAPM&R, as well as chair of Rehabilitation Medicine at NYU. So today we're going to be chatting about the Academy's progress and plans, the annual assembly, and how members can help advance the specialty.
Thanks, Heidi. Glad to be here with you.
Yeah, super exciting. So, Dr. Flanagan, your February editorial in the Physiatrist is all about progress and plans. So what were some of the Academy's greater accomplishments in 2022? And then to follow that up, what are some of the Academy's prioritized initiatives in 2023?
Wow, Heidi, I got to tell you, that is really a great question. But man, I hope you have a lot of time because we were busy in 2022 and we have big plans in 2023. And I know we don't have a whole lot of time, so I'll try to encapsulate it as best I can. But we really did a lot in 2022 to advance our specialty, to advance physiatry, and to just try to sort of go into some sort of broader topics. I would say that we help to define PM&R a little bit better, and in some of the things that we do. Like, for example, we created the Cancer Rehab Medicine Core Services that defines and promotes the value of physiatry-led oncological rehabilitation. Along the same lines, we published in our journal the Comprehensive Musculoskeletal Care and Cancer Rehab Medicine Curriculum. This was really to augment the role of program and fellowship directors and the faculty that play a role in training physiatrists. In 2022, we published a lot of guidance statements on PASC. We're going to continue that, not only with PASC, but we're working to develop guidance statements on biologics and develop a curriculum. And we know that that is something that is really big that physiatrists do, and we're leading the way on that. We've advanced our PM&R Bold effort by publishing, again, in PM&R, our paper on the rehabilitation continuum of care, which is a big component of our Bold vision. PM&R Bold is, part of the big mission of the Academy to ensure that physiatrists just don't survive this amazing upheaval that we're all experiencing in healthcare, but that we thrive going forward, ensuring that the rest of the medical world, the C-suites, the payers, government officials, our patients, understand that if we are to fully achieve the triple aim of medicine, better patient outcomes, better patient experiences, and doing it more efficiently, which we all know is a government euphemism for less money, you need physiatry. So we're publishing this and getting it out. We're exploring innovative ways of using telehealth to ensure that we can reach more people who need our services. It's one way of helping to combat the workforce shortage that we're dealing with. We're also defending the specialty, really supporting our members. You may or may not know that the Academy is part of what's known as the Regulatory Relief Coalition, or the RRC. We made strengths with the RRC in advancing the bill that you may know of, Improving Seniors' Timely Access to Care Act. This is a bicameral, meaning it's both in the House and in the Senate, bipartisan, and to help protect patients from that burdensome pre-authorization. And any physician who knows that has to go through pre-authorization for the things that we know our patients need. And you're probably dealing with it now in your fellowship. This is craziness. The Academy members had a virtual day on the Hill, and we do this every single year, advancing legislation on Capitol Hill in the offices of our senators and our members of Congress to advocate for things that are important for us as physiatrists, physicians, and for our patients. This bill has a lot of support, both in the House and in the Senate, and we really had great successes on that day on the Hill, not just for that issue, but for many more. We continue to fight, as we did in 2022, to limit or limit the physician pay cuts, which are always things that come up, every single year, and it drives us all nuts. We continue to do work ensuring that we protect our field, right? There's so much encroachment, folks trying to do what we do, but we know that we do it best. Leading inpatient rehabilitation teams and so forth. So we continue to fight and make sure that there's limited or no encroachment onto our field. And there's a lot more that we need to do. We've been doing it, for many years. We continue to do that, and we are very vocal in making sure that happens. We're advocating, continue to advocate for expanded telehealth innovations, ensuring that we can continue to reach patients even after the public health emergency is over. And actually, that occurs just in 2 months. So we are actively working to ensure that happens.